Okay, so all welcome back to my YouTube channel. Our next topic is Pterygopalatine fossa. So before beginning with Pterygopalatine fossa, we will learn about the boundaries of Pterygopalatine fossa. As all of you can see the diagram, I have marked the anterior, posterior, medial, lateral, superior boundaries all for all of you. As you can see this pink bone, all of this is the maxilla. So anteriorly we have the posterior part of maxilla. Okay, posteriorly we have this part. So what we have posteriorly, we have the pterygoid process. Okay, this in the center is the medial part, that is the perpendicular plate of palatine bone. Okay, then this is the medial. So along with the medial, on the laterally we have the pterygomaxillary fissure. Okay, so superiorly and inferiorly. Superiorly we have the greater vingous sphenoid, and inferiorly we have the pyramidal process of palatine bone. Let's recall each and everything again. Wait for a moment, let me change the pencil color. Okay, anteriorly what we have the posterior part of maxilla. This is the anterior part. Okay, now starting from the anterior, now let's discuss the posterior part. We have the pterygoid process. This is the anterior part, this is the posterior part. Posteriorly we have the pterygoid process. Let's discuss about the medial part. This medial part between the anterior and the posterior is the perpendicular plate of palatine bone. Okay, from the medial to the there is lateral part showing the pterygomaxillary fissure. Okay, then on the top superiorly we have the greater vingous sphenoid, and at the bottom, at the inferiorly opposite to the medial side, we have pyramidal process of palatine bone. Okay, please remember the diagram. Once you remember the diagram carefully, you can label the boundaries of the pterygopalatine fossa very easily. Anterior part of it we have the posterior surface of maxilla. Okay, posterior part of it we have the pterygoid process. Okay, medial part of it we have the perpendicular plate of the palatine bone. Okay, lateral part of it we have the pterygomaxillary fissure. Okay, then superior part of it we have the greater vingous sphenoid, and to the inferior part of it we have the pyramidal process of palatine bone. So these were the boundaries, 6 boundaries involving the anterior, posterior, medial, lateral, superior and the inferior surfaces of the pterygopalatine fossa. Okay, then we will deal about the, please make this diagram once. When you will make the diagram, you will be very thorough about these boundaries. Okay, they will be easy for all of you to remember. Next, what we are going to study are its communications. Okay, first of all we will study what are its posterior communications. Posteriorly you can remember it with the term that is RPP. What does RPP stand for? R is the foramen rotundum, P is the pterygoid canal, and another P is the palatovaginal canal or the pharyngeal canal. Okay, what are the posterior communications? It involves RPP, that is the foramen rotundum, pterygoid canal and the palatovaginal canal or the pharyngeal canal. You should remember the palatovaginal canal is also the another name for the pharyngeal canal. Now we will study where do these structures, the foramen rotundum, pterygoid canal and palatovaginal canal enters. Okay, foramen rotundum enters to the middle cranial fossa. Okay, pterygoid canal then enters to the foramen of lacerum, and the palatovaginal canal or the pharyngeal canal enters to pharynx. Okay, so how they are positioned are, first of all there will be this. I'm making a rough diagram. First of all, there will be palato-vaginal canal, then there will be the foramen rotundum, and then there will be the pterygoid canal. For the mnemonic, you have to remember RCC, that is the foramen RPP, that is the foramen rotundum, pterygoid canal, and the palato-vaginal canal. Where does the foramen rotundum enter? They enter to the middle cranial fossa, and the pterygoid canal enters to the foramen of the lacerum, and the palato-vaginal or the pharyngeal canal enters to the pharynx. These were the posterior boundaries. Now let's begin with the anterior part. Anteriorly, we have the inferior orbital fissure. Inferior orbital fissure. Okay. Then we will begin what is medially, laterally, and inferiorly. Okay. As for all of you, I have drawn here a diagram. Okay. You can look into this. Firstly, there is the infratemporal fossa. Then in between the infratemporal fossa and the nasal cavity, we have the pterygopalatine fossa. Okay. So between the infratemporal fossa and the pterygopalatine fossa, I have marked PTM fissure. What is PTM? That is pterygomaxillary fissure. And between the pterygopalatine fossa and the nasal cavity, I have marked sphenopalatine foramen. Okay. So this will be the medially, this is the medially, and this is laterally. So on the medial side we will have sphenopalatine foramen, and on the lateral side we will have the infratemporal fossa. Okay. So medially we have sphenopalatine foramen, and laterally we have infratemporal fossa. And inferiorly it is very simple, it is greater and lesser palatine canal. So these were the boundaries that you need to remember, or the communications. Posterior communication, anterior is the inferior oblique fissure, medial is the sphenopalatine foramen, laterally is the infratemporal fossa, and inferiorly we have the greater and the lesser palatine canals. So these are the 5 communications that all of you should remember. Firstly, this diagram for the boundaries, and next this small diagram that I have made here. Infratemporal fossa, pterygopalatine canal, and the nasal cavity. Between the infratemporal fossa and the pterygopalatine fossa, I have marked the PTM, pterygomaxillary fissure. Okay. And what are its contents? These were the communication. And what are the contents of pterygopalatine fossa? They are just small. They are pterygopalatine ganglion, maxillary artery, and maxillary nerves. This was all that you should remember about the pterygopalatine fossa. It can come for your 5 marks. Okay. This was all about the pterygopalatine fossa. You should remember the boundaries by looking at the diagram. Please look into this diagram again. We will just revise the boundaries again. Anterior part of it, we have the posterior, just wait. Anteriorly we have the posterior part of maxilla. Okay. Posteriorly we have our pterygoid. Sorry for the little bit of disturbance today. I think this is all for today.